There are different types of implants, saline and silicone. The average life expectancy of an implant is 10 to 15 years. Silicone are also known as coadhesive gel, those more like natural breast tissue, and have less tendency for rippling of the bag, which can be seen through skin on the outer side of the breast. Saline has a tendency to feel a little harder and has a higher risk of potentially rippling. Implants are placed under the muscle and have your own breast tissue sitting on top of it. If you have enough breast tissue of your own, you may not notice a difference between the two. There is also a lower rate of capsular contracture when they are placed below the muscle, and it also helps to disguise the implant. The only potential drawback of this is the possibility for window shading, and the fact that the implants will move when the muscle flexes. Rupture rate is about the same for both, and increases at a rate of 1% per year. The manufacturer will warranty the implant for as long as you have them. If it were to rupture or break, they will replace the implant for free. For the first 10 years, they will also give you a set portion of doctor's fees that you can take to any surgeon to get it replaced. If the saline implant were to rupture, you may notice a size difference right away, or sometimes there may be a slow leak and it can deflate over time. If the silicone implant ruptures, it can be harder to tell. The gel will stay within the pocket that was made for the implant. Usually, your body begins to form capillary contracture around the implant to protect itself, and in turn, it will get harder. Sometimes it's necessary to have imaging done to verify a rupture of an implant. There are different types and profiles of implants. We typically use a smooth, round implant for breast augmentation. We can, however, use any style or type of implant if it's going to give you a better outcome. There are no studies that have demonstrated that there is a difference in capsular contracture or any other benefit or problems with textured versus smooth implants. The anatomical implant do not make the results look any different. They are mainly used and have a greater purpose in reconstruction. It is difficult to get the volume most people want with anatomical versus smooth round. Textured and anatomical implants are more expensive and have not shown any advantage over the smooth round. Breast augmentation does not help with sagging breasts. Sometimes a lift is needed. Lifts are determined by measurements of where the nipple sits in comparison to the fold and distance from the collarbone. From the measurements, we will be able to determine which implant will fit the width of your breast better and not look unnatural. The different implant profiles come into effect for volume and the size needed to achieve your desired results. During your consultation, the doctor will come in and do some measurements, and then we can try on different sizes to get an idea of the results you want to achieve.